Hello, I'm Eric Olson, KSMQ Public Television. On cue today, our special guest, Dr. Adenuga Atewologun, leads Riverland Community College here in Austin, Owatonna, Albert Lea. Thank you for coming in to give us your update on what has been a very tumultuous time for all of us. Glad to have you here. Tell us how things are proceeding at Riverland Community College. You have 3 campuses. You're open for business, but doing so in an online capacity right now.
Yes, thank you very much, Eric. It's been quite an unprecedented time for all of us. Yeah, this came as a very, very unpleasant surprise. Coronavirus pandemic had disrupted the way we deliver instructions. For us at Riverland Community College, what we've done is we extended our spring break by 2 additional weeks. So instead of 1 week, we extended it made it 3 weeks. And the additional 2 weeks, our faculty members, our deans, and our student services staff worked on moving as much as instruction and support services, advising to alternative delivery mode.
So we're talking about online primarily, but also a lot of your programs. I'm thinking the cosmetology program, auto things you have, nursing school, require or would seem to require a hands-on component, which we can't do right now. I don't think under the guidelines, the circumstances.
Yeah, you're right. We could do a lot online, but there is a lot of in-person touch kind of field processes that we need. For instance, some of the labs we can do, nursing, the clinical sites, some of them are not even open for us to allow as many of our students to go in and experience. And then the laboratories, definitely carpentry, welding, auto, diesel technology, some of those things have been more difficult for us to convert to what I'll call alternative delivery, because it's a mixture of things. It's both the online instruction, is the use of video conferencing, Zoom meeting, even sometimes it's email exchange. At times it's also maybe a simulation online using some technology. So it's a really, I think it's more like an emergency distance learning package that our faculty and staff had to adopt very quickly within 2 weeks.
And your college, I know, I would assume others, you're already kind of on the way with a lot of off-campus learning using different ways of communicating, not necessarily on campus. You've already started that. A lot of your students are online. Do you think this will force that issue there'll be more of that in the future?
Yes, we were before COVID-19 selling about 35% of our credits were already online. And that's because of the geographic nature of our campuses. We have one in Owatonna, we have a campus in Albert Lea, we have one in Austin here. So you can imagine that it's important for our faculty to have learned how to deliver a substantial part of their instruction online. So as I said, 35% is quite large. So a lot of our instruction had already been online. So that gave us a head start, so to say. And we have been able to use some of our what we call Quality Matters rubric, which is a national certification of programs that have been moved online instruction that many of our faculty members have already had their classes Quality Matters certified nationally as being the top way to deliver instruction. In fact, we are the leading institution in the state of Minnesota that have the highest number of Quality Matters certified courses. So we had a head start. Unknowingly, investment that we made several years ago, 3, 4, 5 years ago, paying off now.
Well, congratulations for that distinction.
Thank you.
I know during this COVID-19, we're working with a very remote staff who are able from technology to do their work at home. A few of us are remaining here at the station. But your facilities, Owatonna, Albert Lee, Austin, much larger. They're large spaces, and they're really empty right now. What can be used? How can they be utilized? Should they be utilized?
We have closed our Owatonna campus completely, even to staff and employees and students, of course. That means that we have that whole entire nice facility available for the community to use in case of a community health location. So if, for instance, in Owatonna Mayo Clinic Health System, Alina Health Hospital, they want to use our Owatonna campus as a swing space to deliver health care. We're talking about non-COVID related cases, for instance. So if people that are normally supposed to go to the hospitals and the hospital doesn't want to have those patients in the same COVID area where they are treating those patients, then they can come to our campus in Owatonna. It's been disinfected, and we've decided that we will make that so, keep it like that until the end of this semester, which is May 15. And then we'll start kind of revising our plan as time goes on.
Oh, that's very nice. Very good idea. And you have expertise here too with nursing school, nurse labs, and so on. Also,
we have a very well-equipped laboratory here in Austin that we will make available for our health partners if they need them. We have equipment that we can donate. We have some supplies that we can donate. In fact, we've donated some to Girard Academy, and we have a process in place where some of the equipment and supplies requests could go to our Dean of Nursing and Healthcare, Laura Beasley. So people can contact Laura, and we have a way that we're taking an inventory of requests for these health supplies and equipment.
Oh, you're helping out Girard. That's the Academy in Austin for Adolescents. It's still an inpatient school facility, so yes, those students are still there. That's really great. Yeah. As an administrator, I can appreciate that a very small amount, but some of my funding comes from the state of Minnesota. Mm-hmm. A very larger part, I would presume, comes for Riverland and community colleges. Yeah. How concerned are you about like funding for next year and so on? And in our case, some of our funding comes from sales tax revenue. Mm-hmm. And so in the future years, with people being stuck at home, they're not buying as much. So we're talking about that here. How do we make up that shortfall? Yeah. Perhaps you're having those discussions also.
Very true. Yeah, it's not going to be as we planned in terms of our funding. We get close to 50% of our funding from the state. And the state surplus budget forecast is probably not going to be there at the end of COVID-19 mitigation. Definitely, it's not going to be as robust as we were made to understand. And that would affect our planning for FY20, FY21. We are finishing fiscal year 20, which would end June 30. An immediate impact is that our tuition revenue will be impacted somewhat because instead of a planned maybe 2,200 full-time equivalent, we've seen a drop in that enrollment. So some students couldn't finish, they'll have to drop. So it has affected our enrollment for this spring already. We were anticipating to starting some programs the last 8 weeks of the term, which was supposed to be from the 9th of March. So now that couldn't happen. So we lost some enrollment. That would impact our tuition revenue right away.
And I don't know about a lot, but some students, we talk about online, at home, they don't have access to those kind of resources to take advantage, I would assume, online, as they would have come to campus and received education.
Yes, there are many challenges that our students are needing to overcome. There are some students that do not have the right devices. They registered for an in-person, face-to-face portion of a class, and then within 2 weeks kind of we turned the whole world, or coronavirus turned their world upside down. Now they have to acquire the right technology devices. They have to get a printer. They have to find ways to learn how to use technology effectively for instruction. And even some of our faculty had to switch from their way of delivering instruction to using more technology online. So this has created some challenges, and we are meeting them. I must say, I give a shout out to our student services staff. They have been able to remotely advise some of these students. Our students are also contacting their faculty directly. We have a learning management system that we call D2L Brightspace. So every student, every course has a shell that students and faculty communicate. So that way, we know what the challenges for individual students are. And each student has a personalized advisor. It's an engaged advisor system that we introduced about a year ago. And that advising system helps us to connect each student with an academic advisor. So we are talking and finding out, emailing and calling, sending some text messages to find out how our students are doing, and taking care of each student in terms of his or her needs.
This could end up making for a more robust delivery system of online everything, conferencing,
Yes.
Zoom. It will maybe improve all of those services, unfortunately, because of the COVID-19. And good news also, we were chatting beforehand, your facility, you're fine, your faculty healthy, students healthy.
Yes. So far, we haven't had any lab-confirmed case of coronavirus infection in any of our campuses or with any of our staff and faculty or students. So, but we know that this is just something that is affecting everybody, relatives or even friends. We've heard it. So we are not immune to this being around us. So that's why we've taken some very, very strict measures to make sure that we restrict public access to all the buildings. We have done deep cleaning, and we have hand sanitizers. We have the chemicals that are safe to clean and that would kill some of these viruses, or at least make them inactive, because I understand these viruses are not alive, but they need a cell to propagate. So they are not viable if you clean very well. So we're doing that. But we have 3 priorities, and I will be very happy to share those priorities with you.
Please.
Yeah. The first priority is we want to keep all employees, all our students, and the residents that we come in contact with safe. Priority number 2 is that we want our students to get and cross the finish line for spring semester so that they can accomplish their academic goals. Our third priority is to make sure that we save as many jobs as possible. We recognize there will be some financial challenges, but we can do some things now to mitigate against the issues that could come later on when more people than we want lose their jobs. And you know, as you and I know, working brings some satisfaction, and there is a mental health connection to being engaged, being fully and active in a mission. So we want to save the jobs, as many of those as we can.
And you're probably anticipating more shortfall with regard to enrollment the longer this plays out.
That's correct. We have to revise our projected enrollment for next academic year. For instance, we have fortunately enjoyed a growth in enrollment in the last 3 years. Last year, we had about 5% increase in enrollment compared to previous year.
And that's how many students?
We have about 4,800 students that are taking credit classes. And if we add the non-credit, such as the customized training, we have about 10,000 students that we serve. Customized training is when we deliver instruction that are hourly based, maybe at businesses. So amongst those two, the credit side and the hourly based, we serve about 10,000 students.
And that's going to go down.
It will go down. It will go down. Now, if we were to compress all that to full-time students, currently we were training to about 2,180 students, full-time equivalent that we were expecting this academic year. We have had to revise that down by about 5-10% because of coronavirus, the outbreak, the pandemic. It's really, it's a havoc. It's wreaking havoc to a lot of plans.
Well, you're maintaining an upbeat attitude. At least it seems so today.
Well, we have to do that because we will get through this. We're in this together, and we'll get through it. And one thing is, I was talking to one of my direct report, my VP of Academic Affairs. So how are you getting by? What makes you? She said, well, she doesn't mind the challenges. And a lot of us, when we face challenges, we are then able to think more creatively, more innovatively. And by keeping a positive attitude, we really want our employees, our staff, our faculty to know that this is an opportunity for us to be innovative and to be creative.
Well, stay safe.
Yeah, thank you very much.
Great to have you here, Dr. Adenuga Atewologun, Riverland Community College. For now, I'm Eric Olson, on cue. See you again next time.